Okay, so welcome to the advanced knee massage course. And I've lubricated the whole of the leg. And as I said in my presentation, we should start with the back of the leg first. Always start with the good leg so that you get a good idea as to what the client's normal muscles feel like. Although quite often if they've got a problem in one knee, it will be to a degree in another knee as well. So looking at the muscles, we've got the hamstrings coming down from the ischial tuberosity up here, which is at the top. That's your insertion point. And the three hamstrings come down and insert one onto this side and one onto the back of the tibia and fibula. So we've got the hamstrings. Now the hamstrings are going to be, if this is the origin and this is the insertion, what happens when the muscle shortens is that the knee flexes. So the hamstrings are knee flexors. When somebody comes in and says they've got a painful knee, there's so much going on here that the hamstrings are all inserting below the knee. And then you've got the gastrocnemius and the soleus and the peroneus longus and brevis. They're all inserting into the knee as well. And we've covered a lot of revision of the muscles and the ligaments. And you've got all of the ligaments then, the cruciate ligaments, the lateral collateral ligaments. It's a very busy joint altogether. So trying to find out what is causing the pain in the knee really involves you massaging top and bottom, so the hamstrings up here as well as the gastrocnemius and the soleus, to get a good picture of where the pain is coming from. And quite often when you find the muscle that's hurting, then you might have to massage at the attachment and the belly and the insertion. But you can have pain in any of those points along the muscle. So we're going to start with effleuraging the whole leg, making sure we warm up all of the muscles. One of the biggest criticisms of any deep tissue or sports massage is that people go for gold too quickly. So we need to make sure that we warm up the body really well to start with. So I'm going to effleurage the whole leg, and then petrissage the calves, which is a really nice move for relaxing the gastrocnemius and the soleus, coming down to the Achilles tendon. Different types of kneading, petrissage to warm it up. And I like the client to give me their feedback of pressure in terms of 1 to 10, and it's a 7 is what I call the pleasurable agony. So it's a 7 that I certainly don't want to be going any higher and causing any more tenderness for the client than that. So what number is that, Steve? So that's a 6. So I know that we're really working therapeutically, we're relaxing the muscles. And also if you bend the knee and pull across the knee, that can have just a slightly different effect, in as much as the client's got his leg completely relaxed. It's a passive movement, and I'm able to just twang the gastrocnemius and the soleus across and find if there's any more tenderness specifically in that muscle. But this is seeming quite relaxed. So having loosened up the calves, I might then come up and friction gently at first the back of the knee, because we've got lots of lymph nodes in the back of the knee. So it can often be a little swollen, a little tender. We want to make sure that we just clear any blockage in the lymph nodes and push any of those toxins away. And I'm going to do the same effleurage thigh and then petrissage to warm it up. So whatever movements that you've learned already, you can bring these all into your treatment. I've given you a routine to follow, but if you have other movements that you like to use, you can use connective tissue release. If you've done a sports massage and learnt how to use that, you can obviously use vibrations. If you've used vibrations before, then that can be a nice move to warm up the muscles. And again, a nice bit of petrissage to check out where there's any tenderness. And what number is that?
5.
That's a 5, okay. So that's telling me that it's a little bit more tender than below the knee. Would that be right?
Yeah.
Okay. So then we're going to give the knee joint a good friction. Now I'm on the head of the bone, the condyle of the bone. How's that? It's feeling a bit lumpy.
It's tender.
Yeah, so what number would that be?
That's a 7.
That's a 7, is that okay? So that tells me that, I'm not going to use any more pressure, but it's quite tender there. So we have muscles, the hamstrings are coming down and attaching onto here. We're probably coming round a little bit more to the front, round to the pes anserinus, around that side. So we could be coming onto the gracilis, the sartorius, semitendinosus comes across to the medial side and attaches there. So frictioning, is that getting any easier or not?
Slightly, yes.
Yeah. So friction, as we know, is an analgesic move. So it brings the natural endorphins in the body into this area and helps with pain relief and has an analgesic effect. So by frictioning thoroughly onto that muscle, we can help relax it. And we're going to come across the back of the knee, just below, and find the condyle this side. How's this one? Crunchy?
Not so bad.
Not so bad.
5.
About a 5, okay. So a little bit crunchy on this one. And you find these bony landmarks can be quite tender. So we're going to give that one a good friction. And then we're going to come above the knee onto the epicondyle of the femur. And how's that? Bit tender there, it's crunching. It's a good idea to friction from all directions, sort of up and down, following the fibres, and then cross fibre frictions across the bone as well. Just gets this muscle attachment from different sides. And then again on the other side. Bit tender there?
Yeah.
What number?
7.
That's a 7, okay. So by frictioning and warming up, we're going to help the body to release their endorphins and naturally get the circulation going in that area. So if you have any erythema coming to the surface, that's a good sign. It shows that there was a blockage there and you're bringing in fresh oxygen and blood supply into that area. Now, obviously, we don't have all the time in the world, and I think if you've got 2 legs and you've got both sides that you want to do, you're going to be looking at sort of 10 to 15 minutes for each leg, which passes really quickly. And what I'd be doing is probably starting to think about palpating. So I like to come up in 3 rows and bring the thumbs quite deeply up through. Any tenderness there?
No.
That's okay.
Yep.
There. So if you know how to trigger point, when I get to a point that hurts, I'm just going to apply pressure with my thumb. Make sure the client is happy with the pressure. What number is that?
7.
That's a 7. So I'm just going to hang on to it, and what you'll find is as you apply the pressure to the muscle, then that sends a message to the brain to have a sort of neuromuscular effect and release the tension and the pain in the muscle. So we would hope that if it's an acute point, then this will come down quite quickly. If it's more chronic and it's been there a long time, it'll take longer. So, what number is that now, Steve?
5, 4.
It's a 5 or a 4. So we're going to hang on to it, not be too quick to come off. 3. So we're going to effleurage it out and just move up a little bit further. So that one's obviously all right. Now I'm going to come up through the middle. How's this one? Yeah. So nice and slowly so that the client can give you feedback, coming right the way up to the ischial tuberosity, and then we're going to come across and up the medial aspect. There.
Yeah.
Is that the spot? So we're going to apply pressure, and what number is that?
That's a 6.
That's a 6. So we're going to hang on to it. Still a 6?
5.
Okay. So just holding on to it.
4.
And we're going to come off quickly and effleurage out. So if your client had problems with the calf muscles, then again, I would be palpating up the outside of the leg, which is probably on the peroneus longus and brevis. Anything up here?
Oh, there.
That?
Yeah. Oh,
Number?
6, 7.
6, 7. Okay, so breathe in and out. So sometimes when you're applying pressure and you're going palpating, you'll find that you'll have tender spots, micro abrasions all the way up through the muscle. So it can take a lot of time. And the main thing is you want to address the problem that the client comes with. You don't want to get sidetracked and find that you haven't actually addressed their problem because you've run out of time. So I would probably allow a good hour for this treatment. I'm going to effleurage out. And also if you've got a problem along here, this is the peroneus longus and brevis, and the attachment is often in the medial side of the foot, just there. Is that tender?
A little bit, yes.
A little bit. So you might also want to do some frictioning and show the client where they can massage for themselves the attachment under the foot for that peroneus longus and brevis. And then we're going to come up through the middle. Anything? And then finally on the medial side. There.
Yeah.
Breathe in and out. And now
5.
coming a little bit further up. There.
Not too bad. There.
There. So breathe in and out. So I'm just going to hold until that one eases off. And trigger points neuromuscular technique is a very useful technique. If you haven't learnt how to do that, then you might want to think about doing an extended sports massage or learning how to do trigger points, soft tissue release, which are useful techniques to learn. But this is more about using what you have in your toolkit rather than teaching you new techniques as such, but just focusing on the key points around the knee so that you can have a better effect on releasing any difficulties the client might have. So we're going to effleurage to finish, And then I'm going to briefly show you the same on the other side so that you understand how to do on both sides. Okay, so moving down onto the other side, we're going to be lubricating, making sure that we lubricate the whole of the leg. And what you do to one leg, you're going to do to the other. Otherwise, your client's going to feel very lopsided. And this would be the worst leg. So we do the good leg first and then move on to the worst one. So same technique, starting with effleuraging and then moving on to petrissage to loosen up the calf, soleus and the gastrocnemius, coming down to the Achilles tendon. How's the pressure, Steve?
7.
It's a 7, is it? Yeah, it feels tighter than the other one. So I might also sort of friction around the Achilles tendon where you've got the attachments for the gastrocnemius and the soleus. Generally does feel a lot firmer and stiffer, this muscle, not as relaxed as the other one. But I'm going to lift it and twang across the muscle. Is it tender there?
Yeah.
That one. So it's a good idea to give a good petrissage first, and then it identifies the areas. What about there? That you're going to have to work a little bit deeper on in a minute. So we're going to need, you might do some connective tissue. Some vibrations. And then moving on to frictioning around the knee on this side, coming gently across the popliteal lymph nodes to start with. Pushing it up into the leg a little bit further. And then warming up the thigh with kneading, petrissage. How's this?
6.
About a 6, okay. And then we might do some vibrations. Really, I mean, I'm obviously not spending as long as you might do in reality in your clinic to warm it up, but you've got plenty of time. And then I'm going to friction around my bony landmarks, so the condyle of the tibia and the fibula I'm going to work on, and then coming above the knee onto the femur. Is that a bit tight there? Yeah. What number is that one?
It's
Is it a 7? Yeah, I can feel that. It's quite nodular, lumpy. So we're going to warm it up, get the endorphins released to help the natural analgesia, and the same on this side. So I'm going to friction. Is that tender there?
6.
Yeah.
7.
And then above. Whatever way seems comfortable for you, you can do your frictions in different ways, and as I said, you can do cross fibre frictioning, as well as following the fibres of the muscle. That feels a bit tight up there. So then I'm going to effleurage to drain anything I've shifted. And again, I'm going to go in 3 rows. I did the thigh first, so we'll start again with the thigh. So this time I'm going to come up the inside of the thigh. Any trigger points along here? No. So I'm not going to waste time if I can't find any. I'm going to move on. There.
Yeah.
Breathe in and out. What number is that?
It's a 5, 6.
Okay.
4.
Okay. Going to effleurage it out. Move a little higher. There. Okay. Breathe in and out. How's that?
4.
Let's effleurage it out. And then we'll just come up. And then we're coming on the outside. That seems fine. So coming down to the calf. Going to come up the inside. Yeah. Breathe in and out. What number's that?
That's a 6.
Okay. So just hang on to that.
Coming down.
Okay, let's effleurage that out. Come up a bit further. There.
Lower.
Lower.
There.
Okay, breathe in and out. Okay, we're going to effleurage. I'm going to come up the middle. Good. And then finally, I think we're going to find a few along here. There. Breathe in and out. What number?
4.
There. Breathe in and out. What number?
5, 4.
That's good. Well, all of these are coming down. They don't always. Sometimes you can hang on for quite a while and find they don't. There.
Yeah.
Breathe in and out. And if your thumbs start to hurt, you can go for a knuckle. Sorry. But do bear in mind that it is firmer with a knuckle. Oh, sorry. Let me ease off a bit. Is that better? And on bigger areas, you can use a controlled elbow. But obviously, you have to work to your client's pain threshold. So if they're saying that your finger or your knuckle is a 7 or 8, then you're not going to use an elbow. So I'm going to effleurage that down. Effleurage the whole leg to finish. And then you might get your client to do some stretches if you've learned how to do stretches as well. Okay, so turning over, having the client lie supine, the effleurage the whole leg. And just for convenience, we're going to do this leg because the camera's set up, but this is my client's worst leg. So normally I would actually do the good leg first just to see what those muscles were feeling like first. But as I said, just for practicalities today, we're going to do this one first. So I'm effleuraging up. I can feel as I go over those quads. So you've got your quad muscles here. The one on the top, the most superficial, is the rectus femoris that goes right the way up into the front of the hip. onto the anterior aspect of the pelvic girdle, and it comes down under the patella and inserts into the bone by the patella tendon. So, and underneath the rectus femoris, you have the vastus intermedius, and then you have the vastus medialis this side, which is on the medial side, the inside, and then you have the vastus lateralis on the outside. So all of these muscles extend the knee and assist in flexing the hip, particularly the rectus femoris. So I can feel that these are quite tight, and I know that my client went on quite a long cycle yesterday, which has probably triggered off those quads. Now, warming the muscles up with a nice bit of effleurage. We're going to come over the shin. I mean, there's not a lot you can do with the anterior tibialis. It's quite a tight muscle. You can friction up through it. Petrissage is a bit tougher. You could knuckle. Do a bit of knuckling along it. And obviously this muscle is going to dorsiflex your foot. And then I'm going to come up and friction round the knee. It's a bit crunchy there. Is it tender?
Yeah, just a little bit.
Yeah, it's very crunchy. And this side, that's what they call crepitus in the joint. So we're going to do a bit of frictioning under the knee and then around the patella and above the knee. That's quite tight. And I'm going to knead the thigh. Make sure we loosen up the thigh. Use some cross fibre friction. That's a bit tight, is it?
Yeah.
What number is that?
It's a 6.
Is it? And then do some vibrations to try and relax the muscle. And we were talking about the pes anserinus, which is here. Is that tender?
Yeah.
This is the attachments of the sartorius, semitendinosus, and gracilis, and is quite often quite tender. I can feel it's crackling away, twanging a bit in there. What number is that?
That's the 6.
A 6. So we're really going to just loosen it up. So a 7 is a pleasurable agony. It's what I call feeling as though it's doing you some good, although it's uncomfortable. We certainly don't want to be inflicting a lot of pain on the client. We want them to go away feeling as though we've worked out some of their tension and stress points without inflicting more pain and discomfort. This is really crunchy, isn't it, along here?
Yeah.
So I'm going to give it a good frictioning. Very crepitus. And again at the top. How's it there? A bit tender as well.
Yes.
And then we're going to push the leg across. It's got a sort of lateral rotation on it, the leg, which may be coming from the lateral rotators of the buttocks. So it could be piriformis syndrome, could be the glutes that are pulling the leg round, as well as the sartorius, which is a lateral rotator. What about this one? Tender?
Yes.
What number's that?
6.
And again, coming up to the bony landmark there on the epicondyle of the femur. How's that?
It's a 5.
So it's all a bit tight, isn't it?
Yeah.
So I'm going to go and warm up the muscle and check the muscle out first, the belly, and then we'll have a look at the insertions on the knee itself. So I'm going to come up. Anything?
Okay, so
There?
a little bit, yes. Yeah, there.
There?
Yeah.
So breathe in and out. And I'm going to effleurage it out and move on a little bit more. And again. And what I might even do is use a bit of forearm petrissage to loosen up the muscle. How does that feel?
Yeah, that's a 6.
Okay, so especially if you've got, sort of big muscle, somebody with quite a high pain threshold, this can be a very useful movement for getting a bit deeper into the muscle and sort of muscle stripping. And it might bring you into doing some work with the elbow. How's that?
Yeah, tender there.
There. So just having a good grip of the wrist. I've got full weight in my legs so that I'm not going to slip. I'm not relying on my elbow leaning in. What number is that?
5.
So just applying enough pressure again to come to a maximum of 7. And now?
4.
Okay. So coming off, coming up a little bit further. There. What number is that?
That's a 5.
Okay. Now?
Yeah, 7.
Okay. So sometimes you might not put enough pressure on, so you might want to add a little bit more pressure. Just hold. Be patient. Okay, so we're going to effleurage it out, and then we're going to come up along here. There. Breathe in. So I'm not quite on the IT band, just on the vastus lateralis here. And I'm going to effleurage it out. Oh, there. A bit more.
Yeah,
What number?
that's a 6.
Okay. So you might find every sort of little half an inch or so, you might have trigger points and tenderness. And you're just going to take your time and work on as many as you can within the time frame that you've got. But just bearing in mind that we don't have a magic wand, and it might take a few treatments to release all the tension and pressure points in this leg. Finally, I'm going to come up the IT band. Quite often the IT band does kick off. So what I'm going to do is I'm not going to do a lot on that. I'm going to turn the client on the side, make time to do the IT band from that angle on the side. So I'm just going to move straight on and do the other leg. So coming round to the other side, we're going to effleurage. A little bit more oil for a hairy leg. Okay, so we're going to effleurage the whole leg first, And then warm up the muscles with some petrissage. Some frictioning. Maybe a bit of knuckling is quite useful for the anterior tibialis. And then kneading. The client's already got a bruise on his knee, so I would point that out so they don't think that they go home and it's me. God, this is tight. I thought you said the other one was the worst one. This is tight. So this is giving me a good idea of what I've got to look forward to. What I need to loosen up during the treatment. So I'm going to come to the knee, do some nice frictioning below the knee, above the knee, some petrissage. Cool. That's tight there. And then frictioning the attachment below the patella. Coming up the side. Sorry, too much. Might use my side of my arm to knuckle and loosen it up a bit. It's tight, isn't it? Just going to move this one away. Okay, so we're going to friction pes and serinus. Bit tender there. And the bones around the knee, again a bit crunchy. And then coming around the knee, and again it wants to laterally rotate. Tender there. So I can feel that the quads are worse than the lower legs. So I'm going to go start straight away, coming up here. Anything here? There?
Yeah.
It's right on the gracilis. Breathe in. Number now. Okay, so flush that one out. And come up here. What I might do. Number's that?
That's all right.
There.
Oh, yeah.
Number's up.
That's a 6.
Number now. I'm going to effleurage it out. Oh, that's...
Yeah.
Is that as tight as it feels?
Yeah, it is there.
There.
Yeah.
Breathe in. And out. Effleurage it out. There.
Yep.
Breathe in and out. What number is that?
7,
And now?
5.
I mean, I would hang on to it a lot longer normally, that one. Until it came down a bit lower than that. But, you know, I'm aware that you're watching for the techniques rather than waiting for it to come down completely.
4.
Okay. Okay, so I've really worked thoroughly. Does it feel a bit better now? A bit looser? And then I might do the pes anserinus, which is there. Is that tender? Just apply pressure in there. What number?
3.
And then effleurage, so finishing with any other pressure points. Okay, so quite a few clients have pain along the IT band, so just going to show you how you can effectively, if you get a nice position, make the client comfortable, you can effleurage up and use your arm. It's quite a big muscle to work on. So your IT band goes right the way up here and joins the tensor fasciolata. So comes and inserts down here and then comes up all the way. And if you've got a runner, quite often runner's knee is about there, the pain that they feel. But a lot of people have problems with the IT band. So we're going to warm it up. I don't do the IT band all the time on every client, only when it's really necessary and when they seem to be having a lot of problems with it, as opposed to the rest of the leg. So I'm going to come and find the trigger points. So
Yep.
there, what number is that?
That's 7.
Okay, so breathe in and out. And I'm going to effleurage it out and then come a little bit further up.
Yes, there.
There, breathe in and out. What number is that?
6.
So using all the same movements as you would have done on the front and the back of the leg, but just on the side of the thigh. Number?
5.
And I'm going to effleurage it out and come a bit further.
Yep.
There. And effleurage out. Come a bit further. And we're right here on the head of femur now. There.
Yeah.
And off. So then I think you're perfectly happy then with turning over and doing the same on the other side. So we're going to effleurage it down and then get the client onto their back and then onto their other side, and I'd do the other side as well. But as I said, this is not necessarily something I would always do with the knee issue, only if I felt that the IT band was involved as well.